There's a hidden truth that many doctors may not tell you, not because they are malicious, but because the system itself is built on a simple premise. More testing is always better. Every year, millions of seniors dutifully attend their health checkups, believing they are taking the best possible step to protect their health. But what if I told you that for those over 70, some of the most routine tests could actually be a fast track to unnecessary surgeries, debilitating anxiety, or even life-altering complications? Recent studies are shedding a shocking light on this reality. It's estimated that up to 1/3 of all medical tests performed on seniors lead to a cascade of unnecessary treatments that provide no real benefit. And the vast majority of people over 70 have no idea that the risks of some of these checkups can far outweigh the rewards. One of the tests on our list today is now considered so risky, its radiation exposure is being compared to drinking alcohol every single day as a cause of cancer. You won't see this on the news. You won't hear it from a hospital administrator. But the evidence is clear. Today, we are pulling back the curtain to reveal the 5 health checkups you should seriously question after the age of 70, all backed by real science. And you will not believe what made it to the #1 spot on our list. Before we dive in, let us know in the comments below what country you're watching from and your age. Do you feel that the healthcare system sometimes pushes for too many tests? We read and reply to every single comment. And don't forget to like this video and subscribe for more essential health secrets. Now, let's get started. Checkup number 5, the routine bone density scan. It sounds like a perfectly sensible test, a quick, painless scan to measure the strength of your bones and assess your risk for fractures. It's called a DEXA scan, and it's routinely recommended for older adults, especially women. But here is the trap that almost no one talks about. For a person over 70, the results of this scan can create a powerful wave of fear that often leads to more harm than good. That's because significant bone loss is a natural part of the aging process. It is almost guaranteed that a scan will show lower density than a younger person. But this finding, often labeled osteopenia or mild bone loss, frequently triggers an immediate prescription for powerful medications known as bisphosphonates. These drugs come with a host of serious potential side effects, including severe esophageal irritation and a rare but horrifying condition called osteonecrosis of the jaw, where the jawbone itself begins to decay. A landmark study in the Journal of the American Geriatric Society found that for women over 70 with mild bone loss, these medications reduce the risk of an actual fracture by an almost negligible amount over 5 years. However, the risk of suffering from side effects was substantially higher. Consider the story of Eleanor, a 74-year-old avid gardener. She had never fallen, but her DEXA scan showed mild osteopenia. She was started on medication and within months developed such severe acid reflux she could barely sleep. We helped her transition off the medication and onto a robust regimen of vitamin D3, calcium-rich foods like leafy greens and sardines, and simple weight-bearing exercises like resistance band workouts. A year later, her balance was better, her strength had improved, and she had suffered 0 fractures. The smarter alternative for most seniors without a history of fractures is focusing on lifestyle. Strength training and proper nutrition have been proven to reduce fracture risk far more effectively and safely than medication triggered by a fear-inducing scan. But a bad reaction to medication is nothing compared to the fear the next test can cause. Checkup number 4, Brain MRI for mild memory loss. When an older adult starts misplacing keys or forgetting names more often, the immediate fear is always the same: dementia or Alzheimer's. In response to this fear, a brain MRI is often ordered to see what's going on. But here is the uncomfortable truth. In cases of mild age-related memory loss, an MRI rarely provides a useful answer. Instead, it often makes things worse. The trap is that most MRIs on people over 70 will inevitably show age-related changes, things like slight brain shrinkage or small white matter spots. While these findings are typically normal, like wrinkles on the brain, they sound terrifying to a patient. This can trigger a devastating cascade of anxiety, more tests, and even invasive procedures like spinal taps, all based on a finding that may be clinically insignificant. A 2021 study in Neurology Today found that while 86% of scans on seniors with mild cognitive complaints showed some abnormality, only a tiny fraction of those findings were linked to a treatable condition. Think about Walter, a 78-year-old retired accountant who was worried about his growing forgetfulness. An MRI showed these common white matter changes. Convinced he had early-stage dementia, he became deeply depressed, gave up his driver's license, and isolated himself from his friends. His world shrank, not because of a disease, but because of the interpretation of a scan. When he was later given a proper paper-based cognitive screening test, his score was well within the normal range for his age. The smarter alternative, unless there are red flag neurological symptoms like seizures or sudden personality changes, is to start with this cognitive screening. It's a simple, effective tool that evaluates memory and problem solving without the risk of panic and over-medicalization from a brain scan. Now, brace yourself, because the next test is one that can lead directly to a risky and often unnecessary heart procedure. That's our number 3. Checkup number 3, the cardiac stress test. The cardiac stress test, where you walk on a treadmill while hooked up to a heart monitor, is one of the most common procedures for seniors complaining of vague symptoms like fatigue or mild shortness of breath. It's meant to detect blocked arteries. The problem is, for asymptomatic adults over 70, the test is notoriously unreliable. The trap lies in its alarmingly high false positive rate. Studies have shown that for older adults, the stress test can suggest there's a serious problem when there isn't one up to 40% of the time. This false alarm leads patients down a rabbit hole of more invasive and risky procedures. First comes the angiogram, where a catheter is inserted into your arteries. If a mild narrowing is found, a stent might be placed. A major 2017 study in JAMA Cardiology revealed a shocking statistic. More than half of all stents placed after a stress test referral were in patients who had no real symptoms and received no improvement in survival or quality of life. What they did receive, however, were higher rates of kidney injury from contrast dyes, bleeding complications, and long hospital stays. This is what happened to Brenda, a 72-year-old who loved walking her dog. She mentioned to her doctor that she was getting a little more tired on the big hills. A stress test was ordered. The results were unclear, so she was sent for an angiogram, where a stent was placed in a moderately blocked artery. That night, she had a reaction to the contrast dye, leading to acute kidney problems. She spent a week in the hospital. Her fatigue never changed, because it was never a heart issue to begin with. It was simply mild deconditioning. The smarter alternative for seniors without classic cardiac symptoms is a resting EKG, or a coronary calcium scan. A low-radiation CT scan that is far more accurate at showing dangerous plaque buildup without the high risk of false alarms. This next test is one almost everyone is told they need, and the risks are rarely discussed. Checkup number 2, routine colonoscopy, after 75. This one may surprise you, but the routine screening colonoscopy is a procedure whose risks begin to sharply outweigh its benefits as we age. Official guidelines from the U.S. Preventive Services Task Force recommend stopping routine screening at age 75 for most people. There are clear reasons for this. The trap is twofold. First, the preparation for a colonoscopy is incredibly harsh. The strong laxatives required can cause severe dehydration, electrolyte imbalances, and even kidney problems in older adults. Second, the procedure itself carries increased risks, including bleeding, bowel perforation, and complications from sedation, which can affect brain function. A massive study in JAMA Internal Medicine that followed over 1 million Medicare patients found that for every 1,000 colonoscopies performed on people over 75, only 2 lives were saved from colon cancer, but over 20 people experienced a serious complication. That is a staggering 10-to-1 risk-to-benefit ratio. Consider David, a 76-year-old who was excited about an upcoming cruise. His doctor insisted on a final screening colonoscopy, even though his last one just a few years prior was clean. During the procedure, a small, benign polyp was removed. That night, he developed intense abdominal pain and was rushed to the hospital with a bowel perforation. He spent his cruise money on hospital bills and endured a 9-day recovery. The smarter, safer alternative for average-risk adults over 75 is the non-invasive stool-based test, often called a FIT test. It's done from the comfort of your own home, requires no prep and no sedation, and is still highly effective at catching concerning cases that require further investigation. And now, we've reached it. The number one checkup on our list. The one that uses a level of radiation so high, it's now considered a significant cause of cancer itself. Checkup number 1. The annual full-body CT scan. Marketed at private clinics as the ultimate executive checkup, the full-body CT scan promises to catch cancer and other diseases early. But here is the terrifying, scientifically backed truth. For a healthy, asymptomatic person, this test is one of the most dangerous things you can do to your body. The trap is that these scans expose your body to an enormous dose of ionizing radiation, the equivalent of approximately 500 chest X-rays in a single session. A landmark 2023 modeling study suggested that the rise in CT scans may now be responsible for up to 5% of all cancer cases in the United States, putting it on par with alcohol consumption as a risk factor. The scan is almost guaranteed to find something: harmless age-related nodules, cysts, or calcifications that are clinically meaningless. But the moment these incidentalomas are found, a cascade of fear and follow-up is triggered. More scans, PET scans, and eventually invasive needle biopsies. This happened to Susan, a vibrant 81-year-old. Her full-body scan showed a tiny 3-millimeter nodule in her lung. This set off a chain reaction of referrals and tests, culminating in a needle biopsy. The result was benign. It was nothing. But the biopsy itself collapsed part of her lung, leading to a 2-month recovery from a painful hospitalization. All for something that should have been left alone. The American College of Radiology is clear. Full-body CT scans should never be used for general screening. The smarter alternative is simple. Listen to your body. Perform targeted imaging only when there are specific, concerning symptoms like unexplained weight loss or persistent pain. Scanning your entire body, just in case, is like searching for a needle in a haystack with a bomb. So there you have it. The bone density scan, the brain MRI for mild memory loss, the cardiac stress test, the routine colonoscopy after 75, and the full-body CT scan. 5 checkups that are often presented as essential tools for prevention, but can actually push you towards harm. Modern medicine is a miracle, but it is not perfect. The wisest health decision you can sometimes make is to question a test and have an open conversation about its true risks and benefits. Real prevention isn't found in a scanning machine. It's forged in your daily lifestyle. Stay active, eat nourishing food, sleep well, and be a wise and empowered patient. Now, we want to hear from you. Which of these 5 tests have you, or someone you love, been pressured to get? Share your experiences and opinions in the comments below. Your story could help someone else in our community. Thanks for watching.